According to the CDC, disability is a deterioration in the body or mind's condition that affects a person's ability to complete everyday tasks and interact with others. In 2015, a survey was taken by the CDC of the United States, and it was discovered that 43.4 million adults aged 18 and older have a mental illness within the previous year. And 20% of children in the US also have had a seriously debilitating mental disorder. In addition, the CDC stated mental disability is due to so many factors such as trauma, life experiences, biological factors, and sometimes even feeling like you don't belong. We chose to look more into mental disability because a lot is known about physical disability, but we wanted to bring awareness to mental disability in hope of getting people to learn more and seek help if needed.
In discussing the importance of occupational therapy with individuals with disabilities, it was determined that there was a need for OT in pediatrics, adults, and geriatrics. The focus here today will be on serious mental illness, or SMI. The study focused on a systematic review conducted through various databases such as Medline, PsychoInfo, CINAL, and OT Seeker. It was concluded that OT was a positive influence with activities of daily living, instrumental of daily living, leisure, social participation, and rest and sleep. In the occupational-based interventions focused on client-centered goals, demonstrated better outcomes in all performance areas and in social participation. Participants in the cognitive-based interventions demonstrated much improved problem-solving and cognitive skills. In the manual psychoeducation programs focused on illness management, self-management, medication adherence, and problem solvings, these relationships and communications were also seen to improve.
Individuals with mental disabilities may show declines in occupational performance. Mental disabilities often affect one or more of the following categories: motor skills, processing skills, or social interaction skills. These performance areas are critical components of independence of all ages to engage in daily life roles such as student, employee, spouse, parent, child, etc. However, among some individuals with mental disabilities, services to assist with the implementation of coping mechanisms, self-stigma aids, and medical management are not always readily available at the time of diagnosis. According to a study, self-stigma has its greatest impact shortly after diagnosis. With time and supports, the individuals learn to accept and cope with the diagnosis, resulting in decreased self-stigma and increased occupational engagement.
The origins of occupational therapy are rooted in mental health. Oftentimes, those who are affected by mental illness do not have the appropriate resources to appropriately deal with their illnesses and often end up homeless, institutionalized, or in worst case scenarios, being a danger to themselves and others around them. Occupational therapy's goal when working with these types of patients is to facilitate functional occupational performance through therapeutic interventions which focus on promoting wellness, enhancing existing skills, preventing relapse, and creating opportunities. Occupational therapy addresses the typical barriers that many patients with mental illness face. These include the stigma, lack of long-term housing and stability, safety, and socioeconomic status. Studies have shown that keeping these types of patients engaged with meaningful occupation can help these patients lead a functional life.
Mental disabilities were one of the main reasons occupational therapy was developed in the 20th century. Occupational therapy helped deinstitutionalize individuals with mental disabilities and helped start the mental hygiene movement. With the help of occupational therapists, the 1963 Community Mental Health Act was passed. This allowed for therapists and assistants to begin work in the community mental health. Both occupational therapists and occupational therapy assistants are educated to work to provide service that support mental and physical health and wellness, rehabilitation and recovery-oriented approaches. Such education includes at least one clinical fieldwork experience in a setting focused on psychosocial issues. There's evidence-based research that occupational therapy intervention improves the outcome of clients living with mental disabilities. individuals across the lifespan can benefit from occupational therapy.